Ibrima Sadie's 3-year-old daughter, Adama, had a fever in September 2022. Sadie bought some paracetamol syrup from a local pharmacy in Gambia, hoping it would bring his daughter's temperature down. But instead, Adama's fever spiked after taking the syrup. 9 days later, she died in the hospital.
When she passed away, I had to go hold her, kiss her forehead, crying bitterly. You understand? And the doctor said to me, "It's okay," consoling me like, she has gone, so you just have to take heart. And it wasn't easy. It was just not an easy moment.
It was around the time of Adama's death that Gambia's medicines regulator sent a statement to pharmacies suspending syrup sales following a series of suspicious deaths. 1 month later, the deaths of more than 70 Gambian children from acute kidney injury, or AKI, were linked by global health officials to cough syrups made in India. The syrups were contaminated with ethylene glycol, or EG, and diethylene glycol, or DEG. DEG is used in vehicle brake fluid and radiators. The patients were among 300 children killed worldwide last year by contaminated cough syrups, not all of them made in India. It was the deadliest total poisoning on record from toxins that were known to scientists for decades.
Incidents of contaminated cough syrups for children.
The World Health Organization sounded the alarm over the safety of cough syrups globally in January 2023. Tests show the medicines sold in Gambia contained extremely dangerous levels of the toxins. Reuters found some had been sold in bottles wrongly labeled as WHO approved. Cherno Jallo, a pediatric surgeon at the Banjul Teaching Hospital in Gambia's capital, said his staff had been traumatized by the sheer volume of fatalities.
Practicing here as the only pediatric surgeon, I have never seen anything like this. We've been having mortalities, but not this number.
The Indian factory that made the drugs was closed down by authorities in October 2022. Government inspectors found Maiden Pharmaceuticals Limited had violated rules across its manufacturing and testing activities, but later said that they did their own tests and found no toxins in the syrups. India's health ministry said no direct link had been established between the syrups the children took and their deaths. Maiden Managing Director Nareesh Kumar Goyal told Reuters he had not done anything wrong and did not respond to further questions. Gambia, one of Africa's smallest and poorest countries, has no pharma industry, no means of testing imported drugs, and just over 24 pharmacists registered for 2.5 million people. Yet, even as doctors' evidence mounted, Gambian government officials said they wanted more proof. For 2 months, the government did not mention the risk of the syrups in public statements. Medical workers said lives could have been saved had authorities acted quicker. Health Minister Amadou Lemon Samate did not respond to that point, but told Reuters in November he acted fast when he became aware that drugs were the most likely cause. But it was too late for many. Ibrima Sagnia lost his son after taking syrup to treat his fever. Sagnia now speaks for a coalition of parents calling for systematic reforms. He and other parents said the government initially offered them $200 each, but they rejected the sum. Their main goal is to ensure this never happens again.
We are hardly working on that to get lawyers and, of course, good Gambians, to stood with us, to fight with us, to claim justice for the kids. Yes, because we have already lost, but we did not want it to be, to happen again.